Esther. Thank you very much. And Aisha, over to you.
Hello, everyone, and welcome to today's webinar on navigating the NIH grant system as Australian dementia researchers. I would like to start by acknowledging the Wurundjeri people of the Kulin Nation as the traditional custodians of the land on which we meet and pay my respect to their elders, past and present. I would also like to extend that respect to all Aboriginal and Torres Strait Islander people throughout Australia, given that our webinar participants might be watching from different places around the country today. The aim of today's webinar is to learn about the US National Institute of Health, or the NIH, funding opportunities and tips for success. We will hear from a representative from the National Institute on Aging, the NIA, and successful American and Australian applicants. This webinar has been organised by the ADNeT Accelerator Group, and our aim is to support and advocate for early and mid-career Australian dementia researchers and to help develop future research leaders. Just to note that the webinar is being recorded today and will be made available to view on the ADNeT webpage at a later date. I'm one of your chairs today, and my name is Aisha Milligan-Armstrong, and I'm a PhD student from Curtin University. I'm joined by my co-chairs, Associate Professor Duan Ying from NARI and Associate Professor Michelle Lupton from QMI Berghofer. I will now pass over to Duan to introduce today's first speaker.
Thank you, Aisha. It is my great honor to introduce our first speaker today, Dr. Siri Elias. Siri is currently a program director for the clinical interventions and diagnostic branch of the divisions of neuroscience at the National Institute on Aging in the US. She has been a member of the Division of Neuroscience staff since January 2008, creating evaluation and management systems for multiple research portfolios. She co-leads the Alzheimer's Disease Research Centers program and maintains an interest in health equity for the Alzheimer's disease research. She previously held positions at the NIH in the Office of Intramural Research and the Office of Extramural Research for the Office of the NIH Director from 2004 to 2008, where she was the liaison with non-profit organizations, patient advocacy groups, drug industry, and individuals to disseminate NIH policy and programs effectively and creatively to stakeholders. Dr. Elias received her Bachelor of Science in Chemistry from Creighton University and her PhD in Neuroscience from the University of Nebraska Medical Center, both in Omaha, Nebraska. Her scientific research focused on cell apoptosis controlled by peripheral T cells in multiple sclerosis. Her recent programmatic interests are creating new and effective scientific collaborations, facilitating successful mentoring relationships among grantees, and providing effective evaluations of program development. Dr. Elias is published in journals and have served on a number of NIH and NIH committees. Siri, over to you.
Good morning, everyone. Thank you for joining this session. I am going to give an overview of the steps and the policies that are in place at the NIH for foreign applicants and foreign institutions. And hopefully this background can help give you a baseline to begin your journey in finding support from the National Institute on Aging and the National Institutes of Health. I have no conflicts of interest as a government employee. First, we have our website that is very, rich in information. I'm going to go through some definitions at first. I'm going to talk about funding opportunity announcements. We're going to get into the requirements for foreign organizations and the research plan and the application process, and the policies that you have to follow in the grants policy statement, and remind everyone about NIH Fogarty International Center and their contacts there. And then just give you some tips in general about applying for applications in the following bullets. So for definitions, they're very specific about foreign components. You could be a site in a multi-site application that's based in the US, and you would be a foreign component. A foreign institution is the organization of, like in Australia, that's a country other than the US. And foreign organization is different than foreign institution, where it's a non-governmental organization or a charitable organization. And then there's also a definition for foreign public entities. And so, you know, as you go on your journey, you have to kind of understand these definitions. Then when you look for NIH opportunities, in section 3, there's standard language in section 3, eligibility information about foreign institution. It's always these 3 bullets, and they talk about the foreign institutions or the non-domestic components of US organizations or foreign components. And you're looking to see that you are eligible to apply and that you are allowed. And so if you get excited about, you know, a certain funding opportunity, that's kind of where you must take your eyes first to see if your organization is eligible. Once you find a funding opportunity, like the parent R01 that foreign institutions are eligible for, you have to complete and have active registration in the NIH code. So foreign organizations must obtain this in order to register into the system for award management. And that has to happen before you put in your application. The next thing about the funding opportunity announcement is that in section 5 in the application review information, applications from foreign organizations have an additional review consideration. And so reviewers of the applications have to assess whether the project is presenting a special opportunity that this organization has unusual talent, resources, populations, environmental conditions that exist in your country of Australia that aren't readily available in the US or augment existing US resources. And so that has to be a component in your application as you are preparing your research strategy. So in the funding opportunity, you have to find out if that opportunity, if you're eligible to apply, and then cover that extra review consideration. As you're putting together the application, there's an area in the PHS 396 application where you have to answer the question about, you know, whether these activities are outside the US or have partnerships with international collaborators. And so, you know, you check yes or no, and then you have to have a foreign justification that describes these review criteria that we discussed in the slide before. So why should you as a foreign applicant be considered for a possible award and be reviewed? And then there are other instructions about fellowships and multi-projects, because in the multi-projects, you're kind of possibly more to be like a foreign component as part of a domestic application. The NIH grants policy statement and chapter 16 has the policies for grants for foreign organizations, international organizations, and domestic grants with foreign components. And I just pulled out some high-level bullets from this policy. So in general, foreign organizations and international organizations are not eligible to apply for the Kirstein NRSA institutional research grant training programs, program project grants, center grants, resource grants, SBIR, STTR grants, or construction grants. And so it really limits and winnows down the possible grant mechanisms in which you are able to apply. Then, you have to make the case that the proposed project has a specific relevance to the mission and objectives of the institution or center that you're applying for in the funding opportunity announcement, and that your project has the potential to significantly advance the health sciences in the United States. As an applicant to the US National Institute of Health, you're obligated to follow the policies for research misconduct, animal welfare, human subjects, the financial conflicts of interest, inclusiveness in research design, civil rights, lobbying, debt, debarment and suspension, and having a drug-free workplace. The application budget that you prepare for NIH have to be stated in US dollars, and the cost increases for fluctuations in exchange rates are allowable costs that are subject to the availability of funding from the institute or center that you're applying to. You also have to follow the US policies on allowable costs and unallowable costs, and there are some additional administrative requirements that are outlined in the grant policy statement. I also wanted to remind you that NIH has the Fogarty International Center, which is dedicated to advancing the mission of NIH by supporting global health research conducted by both US and international investigators, and building these partnerships between these research institutions across the world. And that Australia will fit into the East Asia and Pacific region, and there's a contact assigned to that region, and that has that. The one tool that we have online is the NIH guide to grants and contracts. This is where you can filter out by ICs and look for awards from NIA by checking them. You can search the active funding opportunities and notices by keywords, and you'll start getting a list of grants and notices. And as I mentioned, the first thing would be for you to click on an RFA and determine if a foreign application is allowable. And that would, help you work that out. I tried to find a way to filter that way, but I didn't find it. So, but you just look in the eligibility section and it'll tell you. But this is our official announcements of what opportunities are available for our grants. And it's where the ICs go to describe the type of research that we're looking to build programmatic excellence in. Specifically for Alzheimer's disease and NIA, for the last 7 years, we've created an AD bypass budget. And so the budgets are published online, and They include recent examples of science advances across multiple research topics. And the latest one that's out is 2020, our prediction for the 23 budget. And later this summer, we would have a new bypass budget for fiscal year 24. But it highlights the topics and the milestones that we're interested in funding and prioritizing for the next year. And so that's a great resource to understand NIA's needs for specifically Alzheimer's disease. Another way to keep up to date with what NIA is thinking is that 3 times a year, we have the National Advisory Council on Aging. And if you sign up for our NIA blog, we will announce what the approved concepts were at that particular council round. So here I'm showing you the council round from September 21. And it gives you a list of links of potential concepts that may become funding opportunity announcements. And so this is where you get the latest information about what potential opportunities there are. And when you click on the link, there are little summaries about the concept and contact information of a program officer to discuss more about that concept. Another tool I like to bring in and just kind of for all applicants is that understanding the cycles and the dates that we accept applications, because understanding the cycles kind of helps you understand or realize the reality of the timelines that exist between, meeting a cycle 1 receipt date, but then actually like getting an answer that you can start and getting the funds. And, sometimes that takes up to 12 to 18 months from the time that you put in an application. And I feel that this table is helpful for you to future plan, these blocks of time of submissions that you're putting in applications for and things like that. Another tool that NIH has is the NIH Reporter. And you can search active projects that have been funded. And here I did a search on NIA and things that were funded in Australia. And you see one of our participants, Dr. Masters, is listed there. And you could see, the details of his project, and you could see another project that was funded. And so there are lots of data within the search. In addition to just projects, you also could get publications, patents, clinical studies, news from these awards that, kind of match up in the Reporter. And so, if you wanted to do a larger search, like within the East Asia and Pacific region, you could add more countries and things like that and see who are the seasoned professionals in your region that have succeeded at getting NIH funding. Another tool within the Reporter is NIH Matchmaker, and that's here in the lower corner. And you could enter your preliminary abstract that you're working on to, write an application. And you can find similar projects that have been funded in the database. and you can find similar program officials to, understand that their portfolio might fit into your abstract. So basically, it's a text match system, and you'll get a lot of information that you could start assembling some data about. One thing that we were talking about is, how the grants policy statement really limits the pool of funding mechanisms that foreign applicants have access to. One that I wanted to be clear about was the K-99 and the R00 eligibility. And it's a Pathway to Independence Award, and it is available for non-citizens, but you would have to be in your residency or postdoc at a US domestic institution. So it wouldn't work if you were still at your home institution or that. So I just wanted to make that clear and understand about that. Some extra kind of resources. This was written about 7 years ago from my colleague who runs the epidemiology portfolio, Dr. Anderson, and he provided a blog for preparing specific aims and writing a strong research plan, and just gave some key pointers about, how to approach these two tasks that every application asks you to do. And, he's a colleague with almost 50 years experience in working at NIH. And so I think that these are strong points. And you can get weekly updates on our policies and our priorities by joining our blog and subscribing to it. In addition, the last 2 years, we've had some new program officers kind of join us at NIA, and Doctors Damali Martin and Amelia Carricker have, written some points about communicating with program officers at NIA and how we're pretty approachable and we're open to discussing ideas. And we're also open to, discussing the complexity of a foreign application and whether or not, your ideas, could work within the NIH. Another way to kind of be involved within the NIA stratosphere is that I think we're in the 6th year of having a research centers collaborative network with the acronym RCCN. And their role is to foster collaborations across NIA center programs. And I think we're up to like 9 or 10 different center programs. And so their role is to be central in preparing emerging investigators for interdisciplinary and interinstitutional research. And so they're on Twitter, they have a website, and I think that would be a good resource to find some collaborators. Then also, I just wanted to shout out my sister IC. They have a podcast about navigating the application cycles, and you could download that podcast there. So if you have any additional questions, I know there's a Q&A panel, and you can email me as well. Thank you.
Thank you so much, Cerise, for your great presentations, which I found very informative and very useful for us as a foreign researcher wanting to apply for NIH funding. I would now like to introduce our second speaker, Professor Larsen Hinton. Dr. Hinton is a professor in the Department of Psychiatry and Behavioral Sciences at University of California, Davis, where he also serves as Director of Geriatric Psychiatry and co-directors of the Family Caregiving Institute of the School of Nursing. He is a clinician scientist with formal research trainings in both medical anthropology and health services research, who has conducted interdisciplinary research, both observational and interventions, with a major focus on family caregiving, dementia, and diverse populations over the past 25 years. He has a strong track record in NIH funding, which has included leadership of NIH-funded centers and center costs, and serving as principal investigators on multiple NIH grants of various types, including P30, R01, R34, R21, R03, and K23 awards. Over the past 10 years, he has conducted research to adapt and test caregiving interventions for ethnically and culturally diverse older adult populations, including his current R1 grant to test the efficacy of culturally adapted versions of family caregiver interventions in Vietnam. Larsen, the floor is yours. Larsen, you are on mute.
Okay, that would help, yeah. So I just wanted to say that I'm going to be giving the perspective of a researcher who has been successful in getting NIH grants, and specifically from getting funding from the National Institute on Aging, which I'm very grateful for. And I hope that this presentation can complement, Dr. Elliott's wonderful presentation, but this much more from the perspective of somebody who has written a lot of grants and hopefully learned a lot over the years about how to do this. Next slide. So just a brief overview. I'm going to be talking, basically first presenting some research that I've done in Vietnam with funding from the National Institute on Aging. I'd also like to mention that these grants that I'll be talking about were actually funded through a Fogarty International Center RFA. And I don't want to get into the details of how this works, but basically, before applying for that type of award, you approach a program officer, the contact at a particular institute, and make sure that the award that you're preparing would be of interest to the institute. And then at the end, I'm going to save some time and just summarize some tips for what I see, at least, is sort of for successful NIH grant applications. Next. So this is I'll be talking about a project that's a global partnership between UC Davis, University of Minnesota, the National Aging Research Institute in Australia, and Dr. Duan Ying, and also the National Geriatric Hospital in Vietnam. Next. So, the first thing to do, I think, in thinking about a good research project is really think of something that is of high public health interest or potentially of high impact, a really important research question. And so we decided to focus on the issue of family caregiving in Vietnam, which is a lower middle income country. And one of the reasons this is significant is if you look at this graph, it shows the dramatic increase in the number of older adults living with dementia in low and middle income countries projected out to 2050. So it's really going to be a huge issue from a public, global health perspective in those countries, including Vietnam. Next. The other reason I think this is important is that, dementia is a condition that people living with dementia, that their care is very costly, both in direct costs and indirect costs. So they're high economic costs. Caregivers themselves are at increased risk for depression, for poor self-rated health. One of the most important issues is dementia-related behavioral problems or changes that can be particularly difficult for families to manage and also create enormous difficulties within healthcare systems, many of which speaking about the US, I'm familiar here with the healthcare system and practice in it. And we're just really, I think, beginning to get up to speed in how to really support families. There is, a strong evidence base showing that family caregiving interventions are at least modestly effective in the US. So there is an evidence base for this. Next. One of the very first things that I think it's important to do in preparing, or thinking about a grant is to do a really thorough review of the literature. And so what we did is we reviewed the literature, did a scoping review to look at what had actually been done in Asia, in high, middle, and low income countries in terms of family caregiving interventions for family caregivers taking care of somebody with dementia. And basically what we found is that if you look at Asia, there are quite a few family caregiving intervention studies conducted in high income countries in Asia, but very few in middle and low income countries. So there's a big gap in terms of our knowledge base. And because of economic and other constraints, that you may have to adapt interventions or develop interventions in different ways for those countries. Next. So, another sort of really important thing to do, which we did in our work in Vietnam, is even before we put in the first grant, we tried to begin to identify really good collaborators and I went to Vietnam in order to really get, I guess I'd sort of say, a lay of the land to understand, locally what was important. And I will say that in my first trip to Vietnam, I thought I was going to be doing depression in primary care settings because I've done a lot of research on late life depression. I went to Vietnam and met with a number of people there, including the director of the National Geriatric Hospital. And after hearing my presentation on collaborative care and late life depression, he said, well, that's a very important area, and that's a very nice set of studies you've done in the US. And then he paused and he said, but what about dementia? And so his priority really was developing family caregiver-giving interventions in the community in Vietnam. He saw that as really a high priority area. So I shifted my interests, and that's actually how I got a foothold in research. On the far left is actually the my grants are multiple PI. That's the other PI, Kim Nguyen, who's at the University of Minnesota and spends most of her time actually in Asia. Next. So this is sort of the good part of sort of traveling around and making good friends and colleagues in Asia. I did a lot of this, again, in advance of the grant. Next. Also in advance of the R21 grant, which is really a pilot grant, we went out and did a little bit of preliminary work. And this is me actually out in the field. We were doing some interviews, and I actually reported that as preliminary data for the R21. And I think that was really helpful in convincing reviewers that I was sort of credible as someone who could do work in Vietnam, and that I really had a good set of collaborators. Next. So now I'd like to talk about our R21 grant that was funded back in 2016, again, by the National Institute on Aging. There was really a marginal amount of funding that came from the Fogarty International Center. And those are the other co-PIs and principal investigators. Next. So what we basically did is we took, after a sort of a review of the literature and looking at the available caregiving interventions, we chose an intervention called Reach VA. And we decided there's a lot of research, almost all of it, or the vast majority of it actually funded by the National Institute on Aging, showing that this is effective, at least modestly effective in the US, and it's been used with multicultural populations. It's a multi-component intervention. It's relatively brief, so we thought it probably would be feasible in Vietnam. And so we decided that we would take this and see if we could actually adapt it. Next. So the R21 sort of began with the literature review. That was before we, certainly before we submitted the grant. Once the grant was funded, we did key informant interviews. We adapted the intervention, we manualized it. We did a pilot case series, and then we did a pilot cluster RCT. And I have to say, this is the first grant I've ever had funded where we actually did more work doubled the amount of work that we actually promised NIA. So we had originally promised an RCT of sort of 2 different groups. And the team decided that we actually would be able to stretch the resources and do a pilot cluster RCT. And so that was really sort of a nice outcome. Next. So we published the results of our study and had some good outcomes. We actually had some pretty large effect sizes for the 2 primary outcomes, which were caregiving burden and also caregiver distress measured by the PHQ-4. We did not see a significant change in Alzheimer's disease knowledge. And if people want to talk about possible reasons for that, I'm happy to do so later in the Q&A. Next. So we also did the key informant interviews led to a paper that we recently published in PLOS ONE about the experience of family caregiving for someone living with dementia in Vietnam, a qualitative study. Again, something else that we added to the literature. Next. So the data from the R21 became pilot data, and really pretty good pilot data, for an R01 that we submitted to Fogarty. And I think the pilot data was really strong, and that's one of the reasons that this was funded on the first go-round. Usually with NIH grants, you have to resubmit. You're lucky if you get them scored. And then if you do so, you sort of respond. And often, if you have a strong application, you get funded the second go-round. Both of these grants were funded on the first round. And again, I think it's because of the strength of our research team. And we really, I think we made a good case that we were credible and could sort of make a difference with our work in Vietnam. The aims of the R01 are to test the efficacy of REACH Vietnam. That's our adapted REACH intervention in a cluster RCT of 300 family caregivers in Vietnam, to do a process evaluation to identify barriers and facilitators of this in the community. And then also the Fogarty grants are kind of unique because in addition to the science, there's also a research capacity building component. And so what we did is we have sort of a national program to provide pilot grants. It's actually based on the Resource Centers for Minority Aging Research, that model to some extent in the US. And so that's the grant. Next. I just put this up because one of the things that was really helpful to me, it has been helpful over my career, is to talk with one of the program officers. And she, for the R01, this was true both for the R21 and the R01, but for the R01, she strongly suggested that in addition to looking at outcomes, that we try to look at mechanisms, because this would add to the scientific value of what we were doing in Vietnam for the broader field. I'll say that also for the R21, when I talked with the program officer about our aims, he said, "There's no capacity building in your R21. I hear that's pretty important in the review committee. You better beef that up." And I'll tell you, if we hadn't done that, there's no way that grant would have been funded on the first round. Next. So this is just something, I'm not going to go into this in detail. This is the stage model for people doing dementia, caregiving or other intervention research. It's really important to take a look at this. It's developed by Dr. Lisa Onken and others. Has really been influential at NIA and is really an important thing to refer to and situate your research within this sort of cycle of research. Our first study was a stage 2. Our second is sort of a hybrid between sort of a stage 2 and stage 3. Next. And so I'd like to just wrap up in the last few minutes by highlighting some tips for successful grant writing and for getting funding through the National Institute on Aging and NIH. First, I think it's really important to choose a novel and an impactful topic or sort of research question, set of hypotheses. And, one way to, figure out whether what you have come up with is novel is to do a really thorough review of the literature to see what the gaps are. And so I can't emphasize the importance of really, coming up with a good topic for research that also will align with the priorities of the Institute, say, for example, the National Institute on Aging. I've already mentioned the importance of strong preliminary data. I think that is really, really important. And often we think of good preliminary data as something that's been published. For our R21, actually, the preliminary data had not been published, and it really was more like field work that we'd done. We visited field sites in Vietnam, we'd taken notes, and we were able to summarize that in our R21 and use it as preliminary data. I think assembling a strong and interdisciplinary research team is absolutely critical. Ideally, if you haven't gotten funding from, say, the National Institute on Aging or NIH, it's useful to have somebody on the team who actually has had some success, because I think they can help guide the team. Dr. Elliott talked about the importance of consulting with program officers. And again, I spoke about that earlier. I really wanted to emphasize that. That's, one of the things that I do is I really try to develop my aims 4 or 5 months in advance. And one of the first things I do after I have the aims page is actually to sit down and talk with the program officer. And I discuss basically the aims and the science that I'm proposing. And often they will have really useful suggestions about that science. They may also have suggestions about the RFA that I should perhaps apply for, another RFA that I should consider. So I think those are really important conversations to have. I would say read the RFA really carefully. There's lots of really important information and keys to kind of what reviewers will be looking for in reviewing the application. In terms of grant writing, I say you've got to start early. In my career, which has spanned a few decades now, I can't tell you how many times I have known of researchers or been collaborating with researchers who really just kind of waited until too late. And there really wasn't time to revise sufficiently the proposal, to run it by multiple people, really refine it to the level that you need to refine it in order to have a chance of getting funded, at least the first go round and even the second go round. Reviewers really pick up, often these grants will go back to the same committee. And if your grant is somewhat, for lack of a better word, kind of sloppy, a lot of mistakes, et cetera, I think you do build somewhat of a reputation with reviewers. And so I think it's really important to have a polished grant. And finally, think ahead. With the R21, we were already thinking about the R01. We were thinking about trying to test an intervention that would be ultimately sustainable in Vietnam. And so I think thinking about next steps and ultimately about sustainability is really important. I'm kind of living and breathing sort of the intervention research world right now. And we really think a lot about that because so much research is done that never actually gets disseminated more broadly. So I'm a big advocate for that. I think one of my colleagues, Laura Gitlin, has convinced me of the importance of that, she among others. So I think those are some of the key points I wanted to make. I look forward to the discussion later and talking more about this.
Thank you so much, Larsen, and again for another great presentation. And I have learned a lot from it. I will now pass you over to Michelle to introduce our panel discussion. Michelle, over to you.
Thanks, Duan. Thanks so much for those great talks. We would now just like to start our panel discussion. So this will include our previous speakers, and then we've also invited 3 prominent researchers who each have experience in applying and also being successful for NIH and NIA funding. So firstly, I would like to introduce Associate Professor Nida Jahanshad from the University of Southern California, or USC. So Nida leads the Laboratory of Brain E-Sciences, studying brain structural variability and its associations with brain disorders. She develops and uses markers of brain structure, microstructure, and connectivity patterns to understand the biological and mechanistic underpinnings of brain function and to predict outcomes in relation to brain health and disease progression. And we're also joined by 2 of our leading researchers here in Australia. So firstly, Professor Colin Masters. Colin is based at the Florey in Melbourne and is co-lead of ADNeT Screening and Trials. Colin is a world-renowned researcher in Alzheimer's disease whose work includes the discovery of the proteolipid neuronal origin of the A-beta amyloid protein, which causes Alzheimer's. More recent work includes the use of PET A-beta imaging and other techniques to identify the time course over which the A-beta accumulates in the evolution of Alzheimer's disease. And finally, I would like to introduce Professor Parminder Satchev. Parminder is Professor of Neuropsychiatry, co-director of the Centre for Healthy Brain Aging at the University of New South Wales in Sydney, and clinical director of the Neuropsychiatric Institute at the Prince of Wales Hospital. His major areas of research are drug-induced movement disorders, brain imaging, cognitive aging and dementia, and is the ADNeT Deputy Director and Memory Clinic co-lead. So I'd like to really thank everyone for joining us today. And I'd just like to start by asking each of the new panel members, Nida, Colin and Parminder, to give a brief summary of their background and also their experience of applying for and obtaining NIH and NIA grants. Maybe start with Nida.
Thank you so much, Michelle. Neda Jahanshad. I was fairly recently an early stage investigator. I had a lot of trials with NIH applications. So I can answer a lot of questions related to early stage investigators and applying to grants. I tried many times. Currently, I do have 2 active R01s. One is funded by the NIA, and I'm very grateful for that. I've also worked with other international collaborators. We do a lot of international work, so I've been on a lot of applications to the NIA that do have a foreign component, and mine have also had foreign components. So happy to help answer what I can related to that.
Thank you, that's great, thanks. Maybe go now to Colin.
Thanks, Michelle. Good morning, everyone. Nice to see you all, and good evening to people in the US. You can tell from my appearance, I'm not an early career researcher. I'm very late stage career researcher, but it's nice to be with you nevertheless. So my first child was born in Bethesda at NIH. So, you know, I'm not a stranger to the NIH intramural program. I've been there, spent many years. And of course, I've been back in Australia for 40 years as well. But only recently did I apply for NIH money in Australia. And the reason was because there was an RFA right in our area of interest, which was all around Alzheimer's disease and drawing international cohorts together. So it was very easy for me to identify in the US partners who had great strengths. And so it was quite easy to pull a rather large grant together. And I'm very grateful for that opportunity. And as some of the speakers have mentioned, you've got to get to know your program officer. And I think, Cerise, you mentioned Dr. Anderson. Is that Dallas Anderson? Yeah, so Dallas is, I'd known him from before, but anyway, he's a very, very helpful individual. And between us, we were able to pull the grant together, and it didn't have much problem going through the study section because being a very old person, I knew most of the people on the study section. But of course, we didn't communicate until well after the whole deal was wrapped up. So that's my history. Thank you.
Thanks, Colin, thanks. And go now to Parminder.
Thank you, Michelle, and hello, everybody. I have been listening to the talks previously, and they've been excellent talks. And I think a lot of what I have to say has been covered already. But I'll just give you a bit of background for myself. I actually never looked to the US. I never worked in the US. So unlike Colin, I don't have any direct connections. I have colleagues I've corresponded with and collaborated with from a distance. So I never looked to the NIH system for funding, and most of my funding has been through the NHMRC. And the reason I got interested in NIH was that attention was drawn to some RFAs which were particularly suitable. In fact, first happened in 2013 that there was a RFA for small grants to actually bring data together to be accessible to researchers internationally. And we had a couple of longitudinal studies of aging that we thought would be of interest. And we were able to make the data from those studies available to researchers. And so we got a small grant at that stage. But then what we had been doing over a number of years was to develop consortia for a number of longitudinal studies. We had two consortia in particular, the COSMIC Consortium, which actually started in 2012. And we had brought longitudinal studies of cognitive aging from around the world. In fact, we had 35 studies in 2017. And again, my attention was drawn to an RFA, which called for consortia of such studies. So in fact, actually it fitted the bill significantly. And that was my first R1. And I decided to go as a sole PI for that. But I did have collaborators from the US who were leaders of some of the studies in the United States studies that were part of the consortium, but there were also PIs from around the world. And it went through first shot really with a very good score. So I was very surprised. I thought, oh, NIH is very easy. We got a good, it was a reasonably big grant, but of course it's not that easy. I think it's just that we had the right sort of populations. In fact, I think that's what was mentioned earlier on, that to actually be competitive as a foreign applicant, you have to have something different. And I asked myself, okay, why would the US taxpayer pay an Australian to do research? It has to have some meaning for the Americans in terms of their health. And I think that's really the question that the panel there will be asking, not the panel that actually scores you necessarily, but it goes up to another policy panel that actually says, okay, why should we fund a foreign applicant? And if you have populations that are not there in the US, of course, these are populations around the world, but they have relevance to American health because America is an immigrant country and there are populations from all over the world living in America. So health of those populations has direct relevance to health in America. So I think that's the second question. Thirdly, of course, is expertise. If you can bring expertise from outside, which doesn't exist or complements that is present in the United States. And of course, we couldn't necessarily say that because there is so much epidemiological expertise there. So we didn't have any special expertise, but we had the right populations. And I think that's really what got us over the line. Now, what's happened, of course, since now we're coming towards the close and the end of that grant, which actually ends in August this year, and we're going for a renewal. And of course, my experience also has been collaboration with Dallas Anderson. He's marvelous. Of course, he's an institution, I think, within the institution of NIH. And he's been very helpful. But we went back to them and we didn't go, the first round, we didn't succeed. So we're revising that application now. We made major revisions and it's now being assessed and we're hoping for a successful outcome of that. We become more ambitious. So one of the thresholds you have to meet, of course, is that most grants, I guess, on R01 are under 500,000 per year. But if you want to go above that threshold, you have to get special permission. And this grant is much larger than that. It's much more ambitious. So that's something I haven't tested as to does that make a difference. I'm reassured by all my colleagues that look, the money is a secondary consideration. They look at the science first, and I'm hoping that that is indeed the case. Although I know from an NHMRC experience that you really cannot clearly separate the two, and the money is always at the back of the minds of the assessors when they review a grant. But certainly we're hoping that will be a good outcome. So I think the other thing, of course, we like about NIH, unlike NHMRC, is that firstly, there is some personal attention to your application. NHMRC, the experience has been that your grant goes in and you never know what happens. It goes into a black box and something comes out at the end of it, and it's a yay or an A. And the scores always don't actually tally or are not consistent with what your opinion of your strengths and weaknesses are, really. So you're surprised by the scores very often as well. And then you put in the grant the next time, or you think you've improved it, but the score is quite different, sometimes often much lower than what it was previously. So the reliability of that system is not really great. And my little experience, I don't think I have a lot of experience with NIH, but little experience is that I think it's slightly more reliable, because I think the assessment process is more rigorous with the NIH and there's more personal attention. I think the program officers make a difference in that. And also there is a second bite that you get and that you are allowed to revise and resubmit the application, the same application. And that I think is really a major difference as well. So I think I'll stop here, and definitely happy to answer any questions if I can.
Thanks so much. Thanks, Kaminda. And everyone already had some really useful insights. So I'd just like to invite anyone watching to please post any questions they have in the Q&A. And I'll also keep an eye on the chat in case people also post there. I think I'd just like to start by asking my own question. So we mentioned, Kaminda and other people have mentioned about resubmissions. So I was interested really in when's it time to kind of throw in the towel? Like how many, I think I've heard that people have submitted 5 times and got the 5th one. I don't know if that's true, or so it's kind of like, how long do you keep trying for it before you think that it's not going to get funded? And maybe, Cerise, do you have any insight on that? Or
I know that it's a daunting process, but I mean, I feel also the last speaker was talking about the opportunity to resubmit. And I think that it's a good opportunity. I think that summary statements, you know, open up to the writer's blind spots that, you know, you may not have seen in, you know, prepping this application. And I think that that is helpful to resubmit. And I think people who repeat submissions kind of have to open themselves up to a little bit more criticism and a little bit more assistance. So maybe your team was, you know, 5 people when you did the first submission, and then you kind of grew it. And sometimes I feel like it takes the whole village to, you know, get you to your first successful application, because it's a process.
I would like to follow up with Perminder's comparison between the NHMRC and NIH. So perhaps the questions go to Perminder's and Collins as our Austrian researchers. What are the key differences between a successful NIH grant application and the NHMRC grant applications? Perminder?
I can go
Colin, yeah.
Because I agree with what Perminda said. I think the rigor of assessment at NIH is far, far superior to what we get at NHMRC. Our system is overloaded and our grants do not get proper peer review. But at NIH, they do a terrific job. Study sections are very expert and are very helpful too. So when you have that second chance to revise, it makes so much difference to be able to take criticisms on board and to revise the grant. So I think that's one major difference between our system and the US. I just think also, you know, the fact that NIA is the lead organization for our sort of work improves things no end, because it is all about aging and dementia. Whereas when we go into the NHMRC system, it's everything right across the board. And so we're competing against cancer, immunology, the whole lot.
Yeah. I mean, I agree fully, Colin. Yeah, I think our system at NHMRC is broken, but I think it's not something we want to necessarily tell young people starting their careers that look, you're up against this system and you have to live with this system. But I mean, certainly we have to try, some of us have to try to change that system. But I think I agree that it's overloaded and they do not put enough resources into that assessment process. Perhaps it's because maybe we don't have, I mean, it's a small country and we don't have enough people, enough independent experts. There's also, I think NHMRC that it's gone overboard in terms of independence of reviewers, and sometimes to an extreme that so many reviewers are excluded because of their connections. And because there are, being a small country, almost everybody knows everybody else and collaborates with each other. So people get excluded to the extent that there are no experts left on the panel. And that's really been one of the major problems we're facing. Also, I think also because the system is overloaded, the reviews that come back are very poor, or we get scores rather than any detailed commentaries from reviewers. And that doesn't help you improve your application, because the scores do not always tell you very much as to what went wrong. And we used to have previously, I mean, there was a time when we used to have interviews for project grants. We used to have more detailed commentaries back from reviewers, but that went by the wayside, again, because they did not have the resources to cope with that. So I think something that really needs to be done, needs to be changed necessarily. I also agree, of course, with you that currently the funding for dementia in dementia-related research in the US is really something that we can only wish for, or it's 2.6 billion per year, whereas NHMRC has only a small fraction of that. And it's not especially, I mean, and there's no special allocation for dementia research within NHMRC. So definitely, it's a battle we face here. We have to lobby and maybe change the situation.
So can I ask Nita, so the question of collaboration between foreign institutions and foreign countries, I think is critical here. If you have a partner in the US, as an Australian, if you can show that you're partnering up with an American group, I think that adds a lot of strength to the application. In the old days, I'm thinking 30, 40 years ago, individual investigators could apply to NIH just as solo investigators, but those days have essentially gone. It's almost impossible now to write a grant as a sole chief investigator and expect to get funded either from NHMRC or from NIH. So it's all about collaboration these days. So Nita, what do you think about that?
I completely agree. Actually, one of the grants that I have now from NIMH, mental health, is what the co-PI is actually in Australia. So we essentially bring our skills together. My work is more in the computational end, and they're more clinical. So we've collaborated quite a bit already. We have publications already. It was just a natural team that formed. Having experts in different domains is essential for any NIH grant. So if you can find that collaboration as Australians within the US, that could certainly strengthen the application, is to have, I mean, as you mentioned, everything is multidisciplinary now. There's so much team science is really, it's essential in everything we're doing. So it really does help confirm that these questions that we're trying to answer, these problems that we're trying to solve, are not just unique to, you know, a particular location, but they're really global problems that we're trying to solve. So bringing people from around the world together on an application does help, and I think in our case it did strengthen it. So I couldn't agree more. It certainly, I think it helps with the significance of the grant too.
Okay, I've got another question from the chat that's come through from Nadika. Are there any specific opportunities for early career researchers within the NIH? If any of our panelists know about that.
So, so I can say that for a lot of the applications for R01s in particular, there is a certain score that usually the grant gets funded. That score is a little bit slightly more lenient for early stage investigators, and especially at NIA with Alzheimer's and related dementia work. That score is probably as lenient as you'll get across the entire NIH pool right now. Of course, this all fluctuates, so it's always good to check and see. But you are putting in the application with others that have applied and received grants before, so so it may or may not benefit you, but they are trying to, and it's been very helpful for, it was very helpful for my case. They really are trying to help promote, give that little extra boost for those that have less familiarity. And I don't remember who had mentioned it, but going in as an early stage investigator, you do want someone on your team, not necessarily, or not actually a co-PI, but a co-investigator on the team that does have familiarity with NIH, because that is going to strengthen the application. And I had written grants previously that did not have a more established investigator on them, and that was one thing the reviewers noticed right away, and they said, you know, there isn't an experienced NIH investigator on this grant, so that just gets part of the review. So I would make sure to include someone as well.
Pumina, you raised your hand, so Pumina, then Larsen.
So I actually wanted to know a little bit more about the Fogarty International Center. Do they have their own funding? What kind of research have they generally supported in the past? We heard from Dr. Hinton, of course, about his work in Vietnam, but in generally the scope of their work.
Thank you, Pumina. Larsen.
You know, I don't know a tremendous amount about this. I mean, my understanding is that Fogarty does not have a huge budget. I mean, it's nothing, it's nowhere near the budget of NIA or other, or many of the other institutes. I think you could probably go to their website and see, see what they've actually funded, or through NIH Reporter. But my experience has been through their RFA that basically, you know, NIA picked up almost all the funding. So pretty, to the R21, they contributed 5%. And I don't think they contributed anything to the R01. So I don't know, maybe Dr. Elliott has knows more. That's about all I know.
Thank you, Larsen. And in the Q&A box, we have the question from Lee Fellow. Thank you to all the presenters, and I had been daunted by applying for NIH funding. So this has been really helpful. Pumina said that he went as so PI on a grant, and I'm curious about any advice around the size of the team. Pavinda?
Yeah, I may not be the best person to answer this question. Maybe Dr. Elliott probably would be the first. But I must just say that when I look at it, just see what seems right to you, really. Is this a grant that you should be leading? And because you have the special expertise and similar expertise does not exist in the US, or you have a special population, and which no one in the US, no research in the US has. If your answer to either of these is no, then I think it's probably best to have someone, a co-PI in the US who's an established NIH researcher. That's my impression. And certainly, I think the size of the team, again, I think because it's peers judging you again. So see what is necessary to cover all bases, really, in that. You do not, so that's really, I think, what seems sensible, again. Yeah. But certainly, collaborative team and covering all bases, really. There's a lack of expertise in a particular area. I think that's something that feedback does suggest. Okay, now they do not have expertise in this. For example, we have a genetics component, which is a very small component in our application, but so no, there is no geneticist on their CR as on the CI. So cover all those bases where you think where your aims take you to. Yeah. Thank you.
Thank you, Pavinda. Yeah.
And I think that, when that question came in, I think we were also kind of having a discussion about the size of teams, and that especially for NIA, like a large, like not for early career researchers, but the goal, of outreaching, internationally is to have these broad collaborations. And so, and I know there was a talk about that.
Thank you, Series. Larsen.
Yeah, I just wanted to say that in talk, if you're considering an application, you've developed aims, that would be a good question for the program officer. I mean, I know that I recently had a conversation, actually it's not a grant, I'm a PI, but I'm a co-investigator. And the program officer from NIA said, you really need to have a neuropsychologist on this grant because you're looking at cognitive outcomes. And, that was a gap, and, that was an important, I think, that was important advice. I just wanted, one other thing I wanted to mention about early stage investigators. One of the issues I think probably is having opportunities to network with investigators in the US and form connections. And I don't know, maybe Dr. Elliott may have more information on this, but I know there are a lot of centers that have pilot grant opportunities. And so there are a lot of Alzheimer's disease centers that have pilot grant programs. And I would imagine that an investigator from Australia could apply for one of those. And the amount of funding is not, really huge, but it would give you kind of a foot in the door. You'd get to know people at that Alzheimer's disease center, and it just might be a good way to network and develop something larger. So just wanted to mention that. Almost all the centers have many of them have pilot grant programs.
I'm open to that suggestion. Thank you, Lex.
I just think we'll just now go to another question from the Q&A from Bianca Brina. For Larsen and Cherise, when working in LMIC where capacity may not be strong, how do you strengthen the local team's track record, or do you emphasize other strengths?
I'm sorry, I didn't catch all of that question. So it's about working in lower and middle income countries. Can you repeat that?
Oh yeah, sorry, yeah. In lower middle income countries where capacity may not be strong, how do you strengthen the local team's track record, or do you emphasize other strengths?
Well, if it through the Fogarty mechanism, the capacity building could be one of the aims, and it really should be. And so I think you take a look, you try to choose the best group. I mean, I chose folks at the National Geriatric Hospital because they have fair amount of experience in doing research and including international research. They have a lot of really, good scientists there. But then, then the R21 and the R01, strengthening capacity was, a significant focus. I guess that's what I would say.
Okay, thanks. Therese, do you have anything to add to that? Or?
I think it has to be like an either or. I feel that, you're going to come into a situation with different resources that reviewers are not familiar with. And I think that, what was the word? It was like the capacity or like a track record. I don't know if you have to spend lots of time kind of beefing up their track record. I feel that, if you find a team that is already kind of committed to the community and where you're trying to do this research, I think that having that involvement in that lower middle income country, that I feel like that is enough, that, that this infrastructure kind of exists, and that this opportunity of this application will, provide an opportunity for them to codify, what reviewers might think that, is a good approach, or, but the community members that you're working with might actually have a better approach. So I don't think it's necessary to beef up their track.
Yeah, thank you. I think Nadika had her hand up first.
Thank you very much. Just a couple of questions with respect to pilot grants. It seems like that's very applicable for early to mid-career researchers. Within that, so in terms of track record, would you expect ECR or early career researchers to already have some track record built up with the US counterparts, or is it sort of taken as a whole team of people who are the most senior supervisors of them will have that track record, but ECRs might not necessarily have publications with the US counterparts when you're applying for the pilot grant systems? And my second question is, with the pilot grants, what type of how much can you sort of ask, or is there sort of a range that you can give us an indication? Thanks.
I think your question is stemming off of the suggestion that Larsen gave a few minutes ago. Each of the Alzheimer's disease research centers in the US, they have a set budget for their pilot awards. So the experience of the international investigator, the early career investigator I don't think it has to be a large track record because you're going in for a pilot award, but you are building a relationship. So, so there has to be some sort of, kind of base knowledge about what that center is focusing on and what their themes are and what resources that you can access remotely because, you're trying to do this work, probably a secondary data analysis of sort. So.
Larsen, you would like to add?
I just wanted to add that there is a mechanism called the R03, which is it's the smallest R grant. And it's the guidelines are you do not need pilot data. And so it's really to generate pilot data, the funding is less. It's larger than the most of the pilots through, say, the Alzheimer's disease research centers, but that would be another good mechanism to look at. The other thing to look at for people who are looking to get funding is through a supplement. And so if there's an ongoing sort of R01, it's possible to get a supplement that is sort of within the scope of the grant, but does sort of expand it in a certain direction. And that's also, I think, is a useful mechanism for getting some funding. So those are generally 1 year awards, and generally it's $250,000 or less. There are exceptions, but in general.
Thank you, Larsen. We have talked a lot about the importance of the collaboration with an US partner. So my questions perhaps go to all the panelists. Should we, as an Australian researcher, lead the applications, or should we ask our US partner to lead it?
I guess one comment I have on that, I think it might depend where's the majority of the work being done, where is the majority of the funds going. In the case that I have a co-PI in Australia, I am the contact PI, but they're also MPI. But I could certainly see in the case where more of the funds would have to go abroad, then you might do it the other way.
Yeah, I would probably say it's whoever is most qualified to do the science. I mean, who really on paper really looks like the best person. And the grants that I've had in Vietnam, the bulk of the funding has actually gone to Vietnam, but I've been one of the two multiple PIs of the grant. So I would say it's whoever really is best qualified to carry out the science. If the bulk of the work is being carried out in another country, you have to demonstrate to reviewers that give them confidence that you'll be able to carry out the work, and having a track record of collaboration probably really helps. But
thank you, Larsen. So you all have been successful with the grant applications to NIH funding. Could you please tell us what do the successful NIH grant application look like?
Fixes from all the unsuccessful applications. I think we've had a lot more unsuccessful applications than successful ones. I've certainly learned a lot from the reviews I've gotten from applications that have not received a score. So I think those have helped me shape a successful one. So I think just don't be deterred from not getting a score or getting bad reviews. I think just use that to your advantage. Now you have a fresh slate to start the new application. For me, not getting the applications was the best training experience.
I second that. I think, constructive criticism and feedback is helpful in the process. I mean, what I see a lot is, I don't like to say it because people say it a lot, but not that you're being too ambitious, but I want projects that are really focused and allow reviewers to believe that you can do what you are proposing to do is a great start. So, if you're trying to build capacity, you might not have this large transformative outcome. You might just have smaller successes that are about capacity building. And that's kind of, again, why I show that timeline where if you get this 5-year grant and you do all the things and the small things that you say you do, what are you going to do in your next 5 years? Because once you start waiting, that 18 months for a decision, you could start, picking up things that you cut out of that application and working it into some other kind of application. So sometimes I think that some R01 ideas are, 5 R01 ideas that people try to shove into one.
Thank you, Sirius.
I would just add to Dr. Elliott's, I really think sometimes the grants are just too ambitious. But I think the other thing that really is important is that they're well written. And that really they're polished in a way that the science, everything is really understandable. And the other thing I think is really helpful is when often the grants get shot, many grants get shot down with the approach. That's really where the worst part of the score is. And so I think really demonstrating to reviewers that in the approach that you've chosen, to show them that you've actually considered other approaches, or you recognize that there may be a limitation to the approach, but you're going to compensate it for this, compensate for that in this way or that way. So you really are demonstrating to reviewers that you've carefully thought about the approach you're taking, and you clearly articulate the rationale.
Thank you.
I've got a question. I think all of the panelists have spoken about the importance of the program officer. So when is a good time to contact the program officer, and how much contact is considered appropriate between the researcher and the program officer? And
I think you have to know what you want to study. You have to have at least your specific aims well written and reviewed, and like a solid approach where like how you want to expand and show the program officer that you have the resources to, and resources, I don't mean funds, I mean more like bodies and knowledge to execute the grant. But basically, in contacting a program officer, we're looking at the aims, and we're really assessing how clearly you're writing and how clearly well written your goal is. And if we don't see it in that page, then we kind of know that that's where to start.
Thanks so much. I think it's almost time for us to close now. Thanks everyone so much I think it's been a really useful discussion. I know for me, it's really made me put my thinking cap on for what I'm going to do. So I'll just pass over to Aisha now to close. Thank you.
Okay, thank you everyone for attending today, and a special thank you to our speakers and our panelists for all your insights and great discussion. And I hope everyone has a really good day. Thanks.
Have a good day.
Thank
Bye.
you.
Thank you. Bye-bye.